Usually, the minute they declare brain death, that means there is irreversible damage to the brain. So from there, we call it as donor maintenance. We maintain the donor so that the vital organs are working well and they can be removed and transplanted to the person who needs. Many people don't accept the fact of brain death, and in many of the cultures, they take heart stopping as the final death. That's the reason the awareness is much lesser and people coming forward is much lesser. But if you look at West, 70% of donations are cadaver, only 30% are live. In India, it is the opposite. 90% are live, only 10% happen cadaver. So we want to educate people more so that they come forward to donate for the cadaver, and we can reduce this way of people, live donors, going for a donation.
Hello, this is Anna Isaac, and joining me today is Dr. Vishwanath S., who is an HOD and consultant of nephrology. He's also a transplant physician at the Manipal Hospital here in Bengaluru. Today, we're going to discuss organ donation, the myths around it, the process, and why there's a shortage here in India. Thank you so much for joining us today, Doctor.
Thank you, Anna. Wonderful talking to you. Please go ahead.
So my first question, Doctor, is what is the process for organ donation, and what is the correlation between brain death and donation?
Correlation between, yeah. See, the process of organ donation, there are two types. One is live donation, where live related people come forward. If they are fit for donation, they can donate. The second process is what is called as cadaver donation, where somebody has a brain death. Unfortunately, if he has complete brain damage and we think the brain is not going to get reversed, so that's the time the family can come forward to donate. So this usually happens in a case of road traffic accident, some brain tumor, or some intracranial bleeding where there is a irreversible damage to the brain and heart is still beating. So that means vital organs are well preserved. So when the vital organs are well preserved, only brain death has happened. There will be a time window where before the heart stops, we can take the vital organs and put it to somebody else who need it. So this is called as cadaver donation or deceased organ donation. Live donation is whoever has is fit, and all of us have two kidneys, part of liver can be given. So that is live donation. Some organs you cannot do live donation, like beat, heart, and things like that. So we have a single organ, we cannot do live donation.
So when it comes to cadaver donation, what are the organs that can be donated, and is there any age group between? Is there any age group or age limit when it comes to such donation, or can anybody donate?
See, in general, all the organs can be donated. For the age group, if you are looking at is cadaver donation, all the age groups we can take. In general, anywhere between 5 years to up to 65, 70 years also we can take. Even extremes of age, few organs can be taken, like eyes, tendons, skin. These things can be taken even at extremes of age. For vital organs like heart, kidney, liver, these things, the age group should be good enough so that the organ is good working. So that's the reason usually it is taken between 5 years to 65, 70 years of age group. And that because it's a vital organ, we don't want any damage to that organ and then pass on to the person who receives it. That's the reason we need to make sure that the organ is working well and they are in the right age group. Sometimes in rare situations, what we do is, suppose you have somebody who is 4 years, 5 years, borderline, and kidney is not good enough to put for a single person. What they do is they take dual organ. So that means they take both the kidneys and put it to a single person. So that over a period of time, it becomes equivalent to a normal one kidney. So there are some situations where we do take extremes of age groups, but in general, this is the age group which we take for cadaver donation. If you are looking at live donation, we usually take between, for kidney, 18 to 75 years of age, and there both the kidneys should be working well and they shouldn't have any major medical illnesses which are contraindication to give. Suppose somebody has a cancer, suppose somebody has an active tuberculosis, things in those situations we cannot take the organ. If they are good, healthy, non-diabetic, we can definitely take the one kidney from them.
You spoke about a window by which these organs should be retrieved. So, is it a 25-hour window or 12-hour window? And by which time should the transplantation also occur?
Usually, the minute they declare brain death, that means there is irreversible damage to the brain. So from there, we call it as donor maintenance. We maintain the donor so that the vital organs are working well and they can be removed and transplanted to the person who needs. The usual window for this time is we cannot maintain the brain death person for more than usually 2 to 3 days, because what happens after that time, heart will come down, bp will come down, the vital organs will get affected. So the minute brain death is affected, there is no time frame to say only this much. Sometimes we can maintain till 1 week, but usually between 48 hours to 72 hours we need to harvest the organs. Harvesting means taking the organ and transporting to the place where they need the organ. Like sometimes we transport across the cities. In some countries they transport across the states, like United States of America. So there again the organ will be transported in a good manner so that the person can receive. So this is the time frame where we can maintain the donor. If you are talking about recipient, the way they receive, each organ has a time frame. Kidney, you can keep the kidney store for 24 hours and within 24 hours you can transplant. Some some vital organs like heart or liver has to be done within few hours, like 6 hours. That's the reason whenever these vital organs are transported, you might have seen in the news where they make a green corridor. So from the airport directly the organ is transported within few hours, because they also need time on table to do the stitching, suturing and things like that. That's the reason usually heart and liver is around 6 to 8 hours. Heart is definitely 6 hours, liver can be stretched up to 8 hours, kidney within 24 hours. Some valves, heart valves or tendons, skin can be done within 24 hours. Eye can be donated even after death, after 6 hours of death, within 6 hours of death. Yes, that is after heart stops.
Okay, and but why is there such a shortage when it comes to cadaver donations, especially? India does have a major shortage.
See, in general, the understanding of cadaver donation, organ death, brain death is much poorer in most of the countries, not only in India. In some countries, if you look at Japan, there is no organ donation at all. So they don't believe in cadaver donation. So there is no cadaver organ donation happening in Japan. In India, at least things are better now. First and foremost is probably because of awareness. Many people don't accept the fact of brain death, so which we need to educate through you people and the media, where we need to tell them once there is brain damage, there is irreversible damage and the chances of recovery is zero. Only when a sorry, when a team of experts certify saying brain is irreversibly damaged, this involves a team of experts like almost one neurosurgeon, one intensivist, one neurologist, one physician, all of them separately certify saying this is brain death and there is no point of return from there. So that's the time when we need to declare as cadaver. This concept has to be passed on to the people and they have to understand that there is a permanent damage. And in many of the cultures, they take heart stopping as the final death. That's the reason the awareness is much lesser and people coming forward is much lesser. Though there are so many brain deaths happening, the cadaver donations numbers is much lesser. But recently it's been much better. In fact, last year, 2022, we did much more cadaver transplants in Karnataka. Karnataka is actually one in the first top three cadaver donations happening. Number one is now Gujarat and Telangana, and of course Tamil Nadu. And again, same thing. People are not understood the concept of cadaver donation. So in some states, there is no cadaver donation at all, like Delhi, Kolkata, and some states where there are very minimal cadaver donation happening. This again because it is not that cadaver deaths are not there. People are not aware. People are not coming forward, or there may not be people certifying the cadaver or brain death.
You spoke about this team of doctors who actually certify the brain death. So, how does this happen? So, it's obviously a team of doctors within the same hospital. Does it have to go to the government? And doesn't this, I mean, once the organ donation happens, does it have to go to a registry, a national registry, or anything like that? Can you just explain that process a bit?
Basically, these team of doctors certify brain death, and the patients who need the organ will be in the waiting list. In our state, we have what is called as Jiva Sarthakate, which is basically run by NIMHANS. They have first come, first serve. So whenever somebody is registered, their blood group and other things details will be taken. Whenever this type of cadaver is available, the families will be informed to report, because they need to match the tissue, and that for that they need this 6 hours for kidney. For liver, they don't match anything directly; they do transplant. So we need to keep them in the waiting list, make sure they are fit for receiving the organ, and once the cadaver is available, because we don't have much time, as I mentioned earlier, you have a window of around 24 to 48 hours once the declaration happens. Within that time, we need to certify, we need to follow all the protocols, we need to take police clearance, we need to have clearance from NIMANS, we need to have clearance from all the certified doctors, and then take the organ and transplant it to the person who needs. So it should be done in war footing. We need to make sure all the processes are taken care of, so that there is no loopholes there. And then whoever is first on the list will be provided the organ, subject to blood test coming matching.
Okay, and there have been studies that show that lack of brain death declaration in hospitals is one of the reasons that organ donation
Yes.
there's a shortage of organ donation.
Yes,
So
yes.
how do you sort of address this challenge?
In fact, see, earlier these cadaver donations used to happen only where the center has a license to do transplant. So now, in fact, they have encouraged people to certify brain death. First of all, first we need to identify the brain death. Once we identify the brain death, then only we can say that this is a cadaver, this person is fit to donate, and then take the organs. Now, in fact, Jeevasarthakate and NIMANS have relaxed the rules, where they have said we can actually retrieve the organ. The hospital where they are taking the organ need not have license to do transplant, but organ can be taken and transported to the place where they have license to do transplant. So this way we can increase the number of cadaver donation, and first and foremost is to probably have a registry of brain death. So once we have, suppose you have 100 brain deaths, in that we can see if somebody is fit to donate. If you don't know that somebody is brain dead, then organ donation won't happen at all. So probably that's the way forward. We need to see non-transplant centers where we can retrieve the organs, and we need to identify the brain death and then inform the Jeevasarthakate so that they can take care of the rest of the logistics. This is where probably we can increase the number of cadaver donation and also increase the awareness among the people. Even in smaller centers, we can take. So when small center there is brain death, you maintain the donor, take the organ from there and transport it to the place where they have license to do transplant. This way we can increase the cadaver donations.
We've been speaking about cadaver donation so far. What about live donation? Is the process similar? Can you just tell us about the criteria?
Live donation, in fact, the process is almost the same, but except that in live donor, because we need to have the safety of the donor, which is first and foremost. So a lot of testing will be there for the donor to make sure that after donation, he's good enough, his health is good, there is no health issues after donation. So testing process will be there, where we make sure all the systems are tested, they are fit to donate, and then organ will be taken. This process usually takes about a week or two. Each organ is different. As I mentioned, see, heart you cannot take live. So liver, a part of it can be taken. Most of us are born with 2 kidneys, so 1 kidney can be taken. So we check for all the other tests, including heart tests. There is no contraindication, there is no malignancy and things like that. We get all the clearances from the other departments, and we also make sure they are psychologically sound enough to donate, and their decision is a good decision, which is a voluntary decision. Then only the organ can be taken. This is how the live donation process happens.
But you have to be a member of the family, right, to actually donate.
Yes.
Okay. Also,
Member of the family being like a son, daughter, children, spouse, parents, first cousins, uncle, aunt can give. Member of the family, and which medically we prove the relationship. Sometimes we do HLA match, we also do DNA fingerprinting, so which is important from legal standpoint.
Okay. Also, in the case of live donors, are there any associated risks for those who actually want to donate?
Yes, see, live donation is a donation where they are going for a surgery which is not needed for them. They're going for a surgery which is needed for somebody else. So the surgical risk is always there. But as I mentioned earlier, we take all the precautions, main precautions, to see that they tolerate the anesthesia well, they tolerate the surgery well. Of course, they'll have a little bit of pain after surgery, Only if this is safe, then we'll take. The risk is only with respect to anesthesia and surgical, which is equal for all of them. Anybody going for surgery, that risk is there. So the same risk applies to the donor. But because we are taking so many precautions, it is like almost 100% foolproof. And anytime we have 1% doubt, 2% doubt, then we reject the donor. So that's the reason getting a live, healthy donor is much, much more difficult. So if you have a cadaver donor, it is a lot more easier, and you're not hampering somebody else's life. And it is cadaver donor is a way of probably living later after death.
And correct me if I'm wrong. I think in India, live donation is a lot more than is higher than cadaver donation, right?
If you look at Indian statistics, almost 90% of donations are live. Only 10 to 15% are cadaver, which is increasing. As I mentioned earlier, again, it depends on each state. But if you look at West, 70% of donations are cadaver, only 30% are live. In US, Spain is leading in the form of in the form of cadaver donation. So in India, it is the opposite. 90% are live, only 10% happen cadaver. So we want to educate people more so that they come forward to donate for the cadaver, and we can reduce this way of people live donors going for a donation. And sometimes you may not have live donors at all. You may not have same group matching donor, fit donor. Now, as you see, many people are nuclear families. It's not like joint families where people used to have some 8, 10 cousins, 3, 4 uncles who would have been fit to donate. Now we have more of nuclear families. So that's the reason live donor availability is much, much lesser.
I mean, there have been a lot of advances in the medical and surgical field, but have there been changes in how an organ is matched or organ rejection takes place? Can you tell us?
Advances have happened both with respect to cadaver and live. In cadaver, earlier people with some infections and things like that, they were not taking like hepatitis C, HIV, sorry, HIV. These people they were not taking. Now you can actually take somebody who's HIV and give to the person who is HIV, because HIV is treatable. HIV also is treatable. So HIV donor can be given to HIV recipient. This is with respect to cadavers. With respect to live, earlier we used to take only blood group matching donors, like O group can give to anyone, AB can take from anyone. A can take only from A and O. Now we have what is called as ABO incompatible transplant, where blood group may not be matching, but we look at their antibody titers and then we can change the blood group and do. This is called ABO incompatible or across group transplant. This is a significant improvement. This has actually come from Japan, where, as I mentioned, there is no cadaver. So they were looking at other options of taking other live donors, where they have changed the blood group and they have shown equally good results. That's the reason we have now doing more and more across group transplant, which has become successful, and it is almost equivalent to ABO same group blood donation. We also have what is called as high risk transplants, where people may be sensitized to the donor, where I mean they may have antibodies against the donor. So we can remove these antibodies and do transplant. Earlier, this was not possible. So these are all the advances which have happened medically. And for the safety of the donor, we have what is called as laparoscopic donation. It is not like full cutting of the abdomen like earlier, only keyhole surgery, which is probably much, much more safer for a live donor to go, and recovery time is very less. By fifth day, we discharge. So they can get back to their work by 12 days. In fact, I have many people who have come from US to donate for their brothers, donated, and went back in 2 weeks' time. So this is the advancement. Because of that, we have the luxury of taking the donors even from out of state, out of country, if they are willing and same family.
All right. Thank you so much, Doctor, for speaking with us. Hopefully, this video will raise awareness about organ donation.